If you're a man over 60, have you ever wondered whether masturbation at this age is truly sci-fi? Whether it's actually good for your prostate health? It's an important question, and one that many men quietly think about. Most people assume it's just a private, harmless activity. But recent research has revealed that if it's done the wrong way, it can have a negative impact on men's health after 60s, especially when it comes to the risk of developing prostate issues. Hello, everyone. I'm Dr. Hale, a board-certified urologist with over 20 years of experience in men's health. I've helped thousands of patients address everything from prostate concerns and erectile dysfunction to the natural changes that come with aging. Before we dive in, take a quick moment. If you've been feeling low on energy lately, drop a yes in the comments below, and don't forget to subscribe. And hit the notification bell so you won't miss any of my future videos. Make sure you watch until the very end, because I'm going to share a special tip that can naturally improve your blood circulation and boost erectile health without pills or invasive treatments. So, grab a cup of coffee or tea, settle in, and let's go through the 3 most dangerous mistakes men over 60 must avoid when masturbating. I'll give you medical insights from a urologist's perspective, so you can maintain your sexual health. Protect your prostate and steer clear of the common mistakes that can harm older men. Let's get started. A lot of the men I see in my practice, especially those over 60, come in with the same frustration. Sex just isn't as pleasurable as it used to be. They struggle to reach climax, and they often feel like they need more and more stimulation to feel anything at all. You might be experiencing this right now. You're not alone, and it's not an inevitable part of getting older. In fact, one of the most common causes is something you can easily fix at home. It's what we call the death grip. This isn't a medical term you'll find in a textbook, but it's a real issue that happens when you use an overly tight, aggressive grip during masturbation, often developed over many years. While it might feel like the only way to get a strong sensation, it's actually doing more harm than good. A constant, tight squeeze can decrease nerve sensitivity over time, making it harder and harder for you to feel pleasure. Why this is a problem, think of it like this. Your body adapts to the stimulation you give it. If you're constantly using a tight, firm grip, your nerves get used to that high level of pressure. When you try to be more gentle or when you're with a partner, the sensation just isn't there anymore. It's frustrating and can lead to a loss of confidence and enjoyment. Furthermore, this habit increases your risk of injury. The Cleveland Clinic points out that too much pressure can cause micro tears in the delicate skin and tissue of the penis. These small injuries can lead to swelling, inflammation, or even a buildup of scar tissue, which can reduce flexibility and cause discomfort. The problem isn't just physical. This frustration can also take a toll on your mental and emotional energy, leaving you feeling less vital and confident. The solution is easier than you might think. Start by being more mindful of your technique. The single most important tip is to use a generous amount of high-quality, water-based lubricant. This reduces friction and allows for a smoother, gentler motion without needing a tight grip. Next, focus on a lighter, looser hold. Slow down and try to pay attention to the sensation, not just the end goal. This might feel unusual at first, but with practice, you'll retrain your nerves and rediscover more natural, pleasurable sensations. It's about quality, not just intensity. Another common issue I see in my practice is men ignoring what their bodies are telling them. You might be experiencing some new discomfort, a slight soreness, a dull ache, or a feeling that things just aren't right after a sexual activity. The problem is, you might be brushing it off, thinking, I'm just getting older. This is normal. I want to be clear, pain and discomfort are not a normal part of aging. They are your body's signals, and you need to listen to them. This brings us to the importance of safe masturbation for seniors. Your body changes as you age. The tissues and blood vessels in your pelvic region are not as resilient as they were in your 20s or 30s. What was fine back then might now lead to injury, inflammation, or discomfort. Ignoring these early warning signs can lead to more significant problems down the road, impacting your quality of life, your confidence, and your overall vitality. What to look for and why it's important. What are some of these signs? A dull ache in the testicles or the perineum. The area between the scrotum and the anus. A feeling of being overstimulated or a burning sensation. Any noticeable soreness or swelling. Ignoring these signals is a mistake. Continuing to apply pressure or engage in a technique that causes pain can lead to chronic inflammation or a condition called pudendal neuralgia, which can cause persistent pelvic pain. This can, in turn, affect your overall energy levels, your mood, and your ability to focus on other aspects of your life. A common misconception is that pushing through the pain shows strength. In reality, it's just putting you at greater risk. The Mayo Clinic consistently emphasizes that paying attention to your body and addressing discomfort is a key part of maintaining health at any age. The tip here is simple, but powerful. Slow down and be mindful. If you feel any discomfort, stop. Don't ignore it. Take a break. Adjust your technique. Think of it as a form of self-care. It's about being present and tuning in to what your body needs. Taking a break and returning with a gentler approach is not a sign of weakness. It's a sign of wisdom. Do you find yourself speeding things up, thinking that a faster pace will lead to a better, more intense climax? This is a very common thought, but it's actually one of the biggest masturbation mistakes in older men. You see, as we get older, our bodies change. What worked for you in your younger days can actually become harmful. Our tissues and skin become less elastic and more susceptible to injury. Pushing for a high-speed, aggressive experience puts you at a much higher risk of injury than you might think. This is a misconception that can have real consequences. While a penile fracture is rare, it can happen from a sudden, forceful bend to the penis during a high-speed climax. Even more common are micro tears in the skin, swelling, or localized pain that can make you dread your next experience. According to sources like the Cleveland Clinic and the Mayo Clinic, a gentler approach is always recommended for older men to prevent these kinds of injuries. A habit of aggressive stimulation can also affect your mental state, making the experience more about a frantic chase for an end goal than about real pleasure and connection to your body. This can lower your overall sense of well-being and confidence. The great news is that the solution is simple and much more satisfying. Instead of focusing on speed, focus on sensation. A slower, more intentional pace allows you to be more present in the moment and tune into your body's signals. This can lead to more intense and fulfilling orgasms. Think of it as a quality over quantity approach. You're not trying to win a race. You're trying to have a pleasurable, safe experience. By slowing down, you're not only protecting yourself from injury, but also training your mind and body to find satisfaction in a more deliberate and healthy way. This is a practice that can improve your overall vitality and even your memory as you become more mindful of your body's needs. If you have any questions about the issues we've just discussed, feel free to leave a comment below. I'm always here to listen and help. Now, let's move on to our next topic. One of the most important for men's health, the role of your prostate and how we can protect it. Many men I see in my practice worry about their prostate as they get older. It's a valid concern. You might have heard about prostate issues, and you might even wonder if your own habits, like masturbation, could be a factor. The truth is, there's a lot of old-fashioned advice and myths out there that just aren't true. For a long time, people thought that any kind of sexual activity might be bad for the prostate. But modern research has shown us something very different. I want to talk about a major finding in men's health: the link between ejaculation frequency and prostate cancer risk. A large-scale study published in the journal European Urology tracked thousands of men over many years. What they found was fascinating. Men who ejaculated more frequently had a lower risk of developing prostate cancer. This isn't a silver bullet, but it's an important piece of the puzzle. So, how does this work? It's believed that regular ejaculation helps to flush out the prostate gland. This process clears out potential carcinogens and other substances that can build up inside. Think of it like regularly cleaning something out to keep it from getting clogged. It's a simple physiological mechanism, but it can have a big impact on your long-term health. A common misconception is that saving it up is better for you. Some men believe that frequent ejaculation drains their body of vital energy, but this is a myth. In reality, a healthy, consistent practice is what's beneficial. The key takeaway here is simple. Regular ejaculation, whether through masturbation or with a partner, can be part of a healthy lifestyle for your prostate. If you've been avoiding it out of fear, I want you to know you don't have to. It's about being consistent and mindful. Just a few times a week can be enough to potentially help keep your prostate healthy. Combined with a good diet and regular exercise, this can be a powerful way to take control of your health. Have you ever found yourself worrying that your erections aren't as firm or reliable as they used to be? It's a common concern for men over 60, and it can really affect your confidence and vitality. A lot of guys assume this is just an inevitable part of getting older, but what they don't realize is that it's often a sign of a very fixable issue: poor blood flow. This brings us to a crucial topic: how to improve circulation for erections. You see, an erection isn't a magical event. It's a physiological one. Depends entirely on a healthy cardiovascular system. When you're aroused, blood vessels in the penis must expand to let blood rush in and get trapped, creating firmness. If those vessels are unhealthy or clogged, the process simply can't work as well. This isn't just about sexual function. It's a huge clue about your broader well-being. As Harvard Health has noted, the link between erectile dysfunction and heart disease is strong. What's bad for the blood vessels in your heart is also bad for the blood vessels in your penis. So, by taking steps to improve circulation in your pelvic region, you're also taking a powerful step toward protecting your heart and brain. Masturbation, when practiced correctly, can be a great way to exercise those blood vessels. It keeps them active and promotes healthy circulation in the pelvic area. The common misconception that sexual activity wastes energy is simply false. A healthy practice helps to keep your vascular system in good working order, which, in turn, boosts your overall vitality and confidence. The best part is, you can improve this with a very simple lifestyle change. I encourage all my patients to get a daily dose of light cardiovascular exercise. Something as easy as a brisk 20-minute walk every day can make a massive difference. This consistent movement helps keep your blood vessels healthy and flexible, not just in your legs or heart, but throughout your entire body. Many of the men I see in my practice, especially those over 60, come to me with a real fear that their energy and vitality are slipping away. They worry about their testosterone levels, and some even believe that activities like masturbation might be a part of the problem. If I think it uses up their testosterone or drains their body of a vital resource, I want to address this directly. This is a myth, and a very common one. The reality is that your body is a brilliantly designed machine, and it's constantly regulating itself. When it comes to low testosterone after 60, the biggest causes are lifestyle factors, not masturbation frequency. There might be a temporary fluctuation in your hormone levels right after ejaculation, but this is a normal part of your body's cycle. Regular sexual activity and masturbation absolutely do not cause a long-term drop in your testosterone. In fact, a healthy, confident sex life can be a great indicator of your overall well-being. A common misconception is that you need to save up your sexual energy to maintain your hormone levels. This isn't true. The real consequences of this kind of thinking aren't physical, but psychological. The fear can create stress and anxiety, which are far more likely to negatively impact your hormone health than the act of masturbation itself. Your mental and emotional state have a direct connection to your physiological health. So instead of worrying about your masturbation habits, I want you to focus on the things that have a real scientifically proven impact on your testosterone. My simple advice for all my patients is this: focus on a balanced diet, get regular exercise, and prioritize good sleep. These three things, eating well, staying active, and getting proper rest, have a far greater and more lasting effect on your hormone levels, your energy, and your confidence than the frequency of your masturbation ever will. The truth is, gentlemen, taking control of your health after 60 isn't about fighting aging. It's about embracing it with wisdom and intention. What we've discussed today boils down to this: listening to your body and treating it with kindness. You've learned that simple adjustments, like being gentler and paying attention to any discomfort, can make a world of difference in your physical well-being and your enjoyment. My one small but powerful piece of advice for you today is to incorporate just 5 minutes of mindful stretching into your daily routine. This can improve blood flow, reduce tension, and connect you more deeply with your body's signals. Remember, this journey to renewed energy and vitality is a marathon, not a sprint. There will be good days and some challenging ones, but by staying informed, being proactive, and making small, consistent changes, you are investing in your future happiness and health. I have no doubt that with a little self-awareness and a commitment to your well-being, you can absolutely regain that energy and confidence you deserve. Keep taking those positive steps forward.